Welcome to my YouTube channel America Children Health Insurance and Healthcare. Health Insurance and Children in America. This chapter compares trends in health insurance coverage across three major coverage groups of children in the United States. Those with employer-based coverage, private insurance, those enrolled in the Medicaid program, public insurance, and those who have no insurance. Uninsured trends in insurance coverage for adults are also included for purposes of comparison. The chapter reviews evidence of patterns in children's insurance coverage by age, race, ethnicity, parental income, and parental employment. The chapter also reports evidence on the duration of insurance and describes regional variations in the rates of insurance. For ease and identifying trends that are described in the text, the figures in this chapter present data for individuals with the main source of coverage employer-based private and Medicaid public coverage, and for uninsured individuals. The tables in the chapter present a complete array of all sorts of health insurance coverage and also give accept percentages. In the United States, the private sector provides health insurance for the majority of children and adults, primarily through employer-sponsored coverage. See table 2.1 and 2.2. This is in contrast to other developed countries, Canada, United Kingdom, France, and Japan, which rely primarily on public sector financing of health insurance. In the United States, public sector financing of children health insurance is primarily through Medicaid, a program financed by the federal and state government and administered by the states. In 1985, approximately 1 in 4 children, 23%, were enrolled in Medicaid. Other sources of public insurance include military health care and Medicare together. However, these other sources provide coverage for fewer than 5% of insured children. As of 1984, approximately 14% of American children, or about 10 million children, did not have any insurance coverage. By 1996, this figure had grown to more than 11 million children. As later sections of this chapter indicate, the majority of these uninsured children live in working families. These working parents do not have coverage through their employers, earn too little to be able to afford to buy health insurance on their own, and earn too much to be eligible for public health insurance such as Medicaid. For uninsured children, access to health care is often unaffordable or otherwise out of reach. Unable to pay for needed care, their parent may decide to delay treatment and hope that a medical problem will resolve on its own. Health problems that are minor in their early stages can escalate to serious costly medical emergencies, and delays in access to health care can increase the burden of suffering from disease. This is especially true for children with special needs and chronic diseases. Insurance coverage trends of children and adults. Who is insured and who is not? The US healthcare system is often described as a patchwork of funding streams, often resulting in fragmentation of the delivery of care. Depending on the methods used to collect and analyze the information from these funding streams, estimates of insurance coverage vary. For example, estimates of Medicaid coverage from the Healthcare Financing Administration differ substantially from those produced by the Bureau of the Census and the Agency for Healthcare Policy and Research.